I'm here in this conference. This is a multidisciplinary conference, so head and neck surgeons ask also radiation oncologists as well as medical oncologists to participate. So I'm giving talk about the significance and the evidence-based medicine that is behind the use of systemic treatments, which is today based on chemotherapy or biological treatments, mainly in the locally advanced disease as well as in the recurrent metastatic disease. So I'm providing state-of-the-art basis knowledge and as well as new approaches that are nowadays coming up. For the locally advanced disease, now we are just speaking about the role of the integration of chemo plus radiation, which happens as an alternative treatment for surgery for select cases, as well as for select cases in the postoperative setting. So this is mainly the topic because this is really state-of-the-art, and I think that here the question is to which extent we are really prepared for supportive care of these patients, and I think that there is still a lot to do in this regard. This is a site-based decision. Main site in two terms: the institution that is operating or irradiating tradition, culture in some instance, and then there are also some indication which are site-specific, meaning the subsite of the tumor. So, for example, nowadays oropharynx is mainly treated with chemorad, and there is now an attempt, a revival of surgery, mainly transoral surgery, but this is only in very select patients, very small tumors, T1, T2 mainly. Surgical studies are underway, and I think we will have a lot of information by these surgical studies that are not frequently done. But now there is an interest in studying these transoral approaches instead of chemorad in order to try to reduce toxicity that is unavoidable at this point with chemorad. It's not a drama, it's not a tragedy, but we do know that there is some toxicity with chemorad. Not yet, in locally advanced I mean. What we know is that immunotherapy is improving overall survival in recurrent metastatic patients, and as you know, in oncology we are always starting from the tail of the disease, meaning in recurrent metastatic disease, and then we are trying to have these new drugs in less extended disease, so I like an adjuvant situations or in combination with chemorad, for example. So we are waiting for these new studies, and of course we will participate in all these studies in order to solve this question. We do know that immunotherapy is extending overall survival in recurrent metastatic patients. Now, the studies that will look at the role of immunotherapy in the locally advanced, so in the curable setting, some of them already started, and I think that we will need some years because fortunately these patients are curable, and so we will need to see and to follow up these patients to know whether there is an advantage of using these drugs. I would say that head and neck cancer is a complicated disease. We really need multidisciplinary approaches. We need surgeons, we need radiation oncologists, and we need oncologists, medical oncologists to tackle this disease. It's not easy, but I think that together we really can make some difference.